13 spine surgeries. That's how many surgeries that Ronnie Coleman, Mr. 8-time Olympia, has underwent.
This guy, Ronnie Coleman, looked like an alien. There was nobody that you could compare that to. Nobody had that.
It's crazy how big and massive Ronnie Coleman is. He's like a freak of nature. I mean, his bicep is bigger than my thigh.
I was getting ready for the Arnold Classic at this time. It was December 1996. Wasn't 600 pounds, and 600 pounds for me is like nothing. I always do like 12 to 15 reps with that, and I was coming up on rep number 8, and pow, this just pop out.
One of the biggest things that I try to stress to my patients and try to harp on is that to avoid squatting. Squatting can cause a lot of injury to your back and to the disc or the cushions in your back. The cushions are the shock absorbers of your back. These are the tissue that's between your bones and provides support. If you have injury to them, this can lead to collapse of that level, and then your spinal canal has less space and less room for the nerves. It can cause back pain and also leg pain. So once you lose and damage your disc, that is irreversible. That's all you have.
You need to be able to see those things in order to be able to appreciate what the hell happened when Ronnie Coleman pulled out of the backdrop and
just wasn't human to just naturally even perceive what he looked like at his peak and at his best.
This guy, Ronnie Coleman, looked like an alien.
Yeah, I mean, he definitely looks like an alien. I mean, that's massive. Takes a lot of dedication and persistence to build muscle, and your body undergoes what's called hypertrophy. But during this building process, to build muscle and also to just grow, your body needs to recover. The problem with a lot of weightlifters and people that go to the gym to lift, they don't give their body time to recover.
Like I said, I train 6 days a week. I only took one day off. I trained Monday through Saturday.
And then your body sustains injury to those muscles, to the ligaments, to the tendons, and they're more likely to tear or to undergo degeneration. So that's why it's important it's okay to train, but you have to give your body time to recover.
When I went to the gym, I lift hard, I lift heavy.
You can see the effect of long-standing lifting and working out has done to his body. He's leaning forward, and that's called kyphosis, and he's using walking aids because he can't stand up straight.
How much pain do you feel every day on a scale of 1 to 10?
9, 10. Yeah, it's pretty heavy. When I do appearances, my pain level goes up to like a 12, 13. It's almost unbearable.
Wow, that's pretty crazy to live in that much pain every day. I see patients in my office who live in severe pain. I can't imagine going through my day-to-day life and being in so much pain. And despite physicians and surgeons who have instructed Ronnie Coleman to stop lifting weights, hey, you're damaging your body. He loves it so much that, he still does it, which is pretty crazy.
I've been in pain for so long now, I'm just used to it. I can take the pills too. It helps it a little bit. And like I said, I take about 4, sometimes 5 a day, every single day. They're called oxycodone.
The medications that he's taking, this medication is one of the most powerful medications out there that we can give to patients. There are obviously some medications that are stronger than that, but that's a really strong narcotic that can probably put a horse to sleep. And he's taking it and still having pain. So that tells me that, the amount of pain that he's having is actually really real.
Ronnie had injured his back, I believe, when he was doing a squat.
Yeah, it was painful, to have a disc just pop out. I was getting ready for the Arnold Classic at this time. It was December 1996. Wasn't 600 pounds, and 600 pounds for me is like nothing. I always do like 12 to 15 reps with that, and I was coming up on rep number 8, and pow, the disc just pop out.
Can't imagine being in the gym and someone's yelling like that the whole time. I've seen some crazy guys in the gym, guys who are lifting all these weights, but someone is screaming constantly while they're working out, that's crazy.
Know what had happened, I just heard a loud pop. I thought the guy actually that was spotting me had hit me to get me fired up, for the set. But he told me, no, man, I didn't touch you. I'm like, what was that loud sound? He said, I don't know. I don't know either, but I'm done with squats. So I went on over and did leg press, did my hamstring, a couple exercises, came home, and I ate, took a shower, put on my uniform to go to work, and I'm like, wait a minute, I'm still in pain. And I like, should I make this right turn and go to work, or should I make this left turn and go to the hospital? So I made the left turn, went to the hospital, and found out, I had a herniated disc.
The surgical treatment for a disc herniation, after failing conservative treatment, injections, physical therapy, giving it time to recover, is what's called a microdiscectomy. This is a procedure where we either place a small tube right over the bone in the back called the lamina to remove that small portion of the bone, and then we move the nerve out of the way, and then we remove the herniation that's pressing on the nerve with special instruments. This is about 60 to 90 minute procedure. Patients go home within 23 hours. One of my favorite surgeries to do. I'm surprised that he's even trying to just go back upstairs. I would think someone in his condition and how severe his condition is, that he would just try to live downstairs instead of going upstairs. This is a x-ray of his lumbar spine. What you can see is that he has screws and rods in his lumbar spine. He also has what's called a spacer. So when there's collapse of that level, the disc is degenerated, you don't have that cushion, it collapses down. When that happens, there's less space for the nerves and spinal canal. So what we do is we go in and put a spacer and to elevate that area to make more space and then lock it down with screws and rods. And that's what places pressure on the level above and also the level below, leading to further degeneration and collapse at those levels over time. But in his case, he has severe arthritis and collapse. With these multiple surgeries, each time that you go in, higher risk of infection, nerve injury, bleeding, prolonged hospitalization, and increased pain. So we try not to perform multiple back surgeries, but sometimes it's unavoidable.
Doctor said he's going to go in and perform a surgery in which he's going to take out screws, because from that nerve block shot that I had, the pain went away for a whole day, and that showed that the hardware was causing the pain, those screws.
The hardware could cause irritation. The hardware sometimes is very close to important structures. What we'll do is we'll send the patient for what's called a spinal block or hardware block, inject medication around that screw. If it relieves pain, then we can be rest assured that that hardware may be causing their discomfort. If we take it out, take the hardware out, then patients can get some pain relief. We have to make sure that that area is fused though. You don't want to take out the hardware when the segment of that part of the spine is not fused. Otherwise, it'll be unstable. The price of success. I mean, it damages your body, your ligaments. He's undergone multiple surgeries, hip replacements, 13 spinal surgeries. Man, it really takes a toll on your body. You got to take care of your back. You have to just make sure that you're doing things properly so that you can live a long life. And if you're 60, 70 years old, you're able to walk without any assistive devices and, spend time, enjoy your family, and just live life. I mean, that's the price of success. That's the path that he's chosen. We can only do so much as spine surgeons, but you have to take that onus upon yourself to understand when enough is enough. And you should take care of your health, of your back, listen to your back. Don't shut up and squat or shut up and lift. You need to listen. If you're having pain, that's an issue. We need to stop, recover, go back into it.